need to be more extensive, but the elephant in the room, Ian, is this. The government still refuses to relinquish power. And we heard Andy Burnham say, and Andy Burnham was very polite to you. He was saying, finally, the government is agreeing to local test and trace. He should be really angry that it has taken so long for test and trace to finally, in some areas, be delegated to local regions. We need to have done this many months ago.
Why has it taken so long? Because you heard me say to Andy Burnham that I talked to the mayor of Birmingham 3 or 4 months ago, and they had started to do it there. It was clearly working, and it wasn't trying to replace the national system. It was a sort of adjunct to it, where if the national system couldn't find someone within 48 hours, they passed it to the local people. Now, that made complete sense to me. I'm sure it made complete sense to you. So why has it taken this long for that to be even considered?
It's a shame. This is central rigid control by Prime Minister Johnson's government, and they are not listening. And it is a tragedy, because the other thing that they're not really listening about is, the messaging. So look, today we've got all these tiers and everything. A lot of complexities will come from it, but they don't give the simple message, which is this. Just because you move from tier 2 to tier 1 doesn't mean the virus has gone on holiday. You will still continue to have good, important, excessive infection control measures. Otherwise, we will be back to square one. And this is what has happened since lifting the lockdown. We didn't do our infection control messaging.
Do you think there is, this is not really your area, but I'm going to ask you anyway, do you think there is an innate conflict between politicians who mouth the platitudes of localism as to wanting to delegate everything to a local level in all sorts of different areas, and the Whitehall machine, the civil service, that hates losing control of anything? And it's the Whitehall machine that is actually stopping this happening.
I don't think it's the Whitehall machine. I think, because having heard Secretary of State for Health and Social Care, Matt Hancock, and Prime Minister Johnson and their cabinet members, they want to have this control under their hands. They're very much married to the central testing and tracing system that they set up. And now they find it difficult to say, actually, we should adopt Plan B.
And that's why the Prime Minister comes in, doesn't he? Because if the Prime Minister sees that something isn't working, he is first among equals, and he can say to Matt Hancock, I don't care what you say, you can resign if you like, this isn't working, and we're now going to adopt this new system, and we're going to involve the directors of public health of all the local authorities far more than we've done so. Do you think that is where we're heading now? Or maybe that has been said?
Please do it urgently. Lives matter in our nation. And I tell you this, look, we're going to get outbreaks in 12 months' time. In 12 months' time, we cannot sustain massive centralized testing and tracing systems. But if we build up local testing and tracing systems, we will be sustainable in 12 months, 18 months, and so on.
Let me read this text out to you. It's from the Hackney think tank, whatever that is, probably an individual, who says, Ian, please get an epidemiologist on to explain why Spain, who's had the most severe lockdowns with police in their streets, today has the worst stats in Europe. Does it show either we crash the economy with permanent lockdown or get back more or less to normal and learn to live with it?
Well, look, the answers are in between. And I personally feel that the roller coaster of lockdown, lift the lockdown, lockdown again is not going to work. What you have to do is sort out your public health measures, and the economy will also, in tandem, sort itself out. What we fail to do continuously is not to address the elephant in the room, which is the virus has not gone away. If you're out and about circulating with fellow humans, you will get infected. Wear your mask and wear it properly. Keep your distances, keep your ventilation going, don't go into crowded places. All these are basic sciences. The virus hasn't changed its behavior. We need to change.